My anatomy exams identify this nerve. Oh my gosh. During anatomy exam, there is what we call steeple chest, and different structures on human body will be pinned and you have to identify them, their action, their supply and other things. So this is one of them where a nerve is being tagged and you have to identify the nerve. And it actually occurs sometimes like this. In these noodles, just to identify one is crazy. I can remember during our anatomy days, in the axilla here, there are branches of the brachial plexus and they will just tag one for you to identify. And that is the moment that you will just get confused. You will not realize even what you are doing. However, you have to decide based on some relations. What's going on, guys? This is Nafada the Medic and welcome to my channel. For those of you who are new, I am Umar Nafada, a final year medical student, and I do videos on medicine and lifestyle. Over the period that I had been on YouTube, I have come across different medical reaction videos. So I now decided to start making reaction videos, and this is my first reaction video on medical memes part 1. Let's begin. When your resident dismisses you before noon. Oh, thank you. I will never forget this. I will fight for you. This is one of the sweetest things that will happen to a medical student during his clinical rotations, more especially to be dismissed from ward rounds, clinics, theater before time. You will feel pleased. Family members, hey, you are basically a doctor. Can you check this out for me? Me, a first year med student. Oh my God. Someone whose limb is being amputated, you are called to resuscitate him and you pick stethoscope, putting on his chest while he is going to die. He is going into shock. This is crazy. That moment when you can't remember all the cranial nerves. Oh my God. There are 12 pairs of cranial nerves that originate from the brain, and they all have different names and they innervate different structures. So it is actually tragic, more especially in the exams, for individual to forget to remember a single cranial nerve. Actually, that exams is very unlikely to end well with that very person. So his reaction shows it. Complex patient with a rare disease. Me, armed with the knowledge from one lecture I watched at 1.8 times speed 3 years ago. There are some patients that you don't even know what to start doing to them. Patient, so this is my first prostate exams. Where should I put my pants? Doctor, over there next to mine. Is this Dr. Egi? I don't know. Doctor, my back hurt when I wake up in the morning. Wake up in the afternoon then. And the patients appreciate this reaction. Oh my gosh. So, case closed. Let's try the other method. Doctor, what happens after we die? Doctor, we clean the bed and admit a new patient. So this is actually what happens in the hospitals. If you are admitted, it is either you are discharged or you die. And if you die, the bed will not follow you now. So here she is seeking for help and she started, any doctor here? So, I am a doctor. What's going on? A heart attack. I am a doctor in mathematics. He is going to die. Prove it. Allow him to die so that he will know he is actually dying. So, when someone says nothing can be more complicated than love, just throw medical books on their faces. When you throw the whole books to someone for him to read, actually you will know the complications are far beyond his thinking. In order to follow privacy requirements, we can't call our patients by their name. The lady with hemorrhoids, please come in. Oh my God. The way this patient is identified with her condition It is better even for her to be called with her name, even her family name entirely. It is better, because this is like exposing the secret behind the patient and telling everybody this is the condition the patient is going through, which is the main reason behind why we should not be identifying our patients by their name for privacy's sake. The doctor says, "Your chest is quite complicated." Why, doctor? What happened? You got a disease from the chapter which I left as optional during my studies. Oh my God. So now that the patient is having a disease that you skipped, you will not treat him, or it is complicated, then it is complicated for you. Refer the patient. Me getting 78% on a test, freshman year of college. 78%, you will feel as if. But in med school, what happened? Me getting a 78% on a test in med school. Wow, great. Actually, if I will be able to get 78% in med school, I will feel like I am a king that very day, and I will even celebrate. Even your colleagues will come and be celebrating with you. The real Krebs cycle. Learn the Krebs cycle, forget the Krebs cycle. Actually, that is how it is, because Krebs cycle is one of the most complicated things that I come across up till today. You will read it now, forget it now. Read it now, forget it now. You have to repeat the cycle, and the cycle continues. Here is doctor telling his patient, want the good news or the bad news first? The good news, please, doctor. Well, they are naming a disease after you. This is likely the patient got a disease that is not known prior to her being diagnosed. So they are now naming the disease after her, and that is the good news. And likely the bad news that she might have is there is no treatment for her disease, and she will be just monitored and be left to die with her condition. Doctor, you will soon be at peace. Man, I am dying. Doctor, no, your wife is. Oh my God. So his wife is trouble that is bothering him. His wife is dying and he will be at peace. Oh my God. This is crazy. First year medical student, med school. Actually, this is how it is. You will come jumping, but you don't know where you are really stepping in. So medical school will only be waiting for you to come, and finally it will deal with you. However, it is easy, nice, and interesting, because it is like suffering and smiling. At the end of the day, you know there is a reward, and that reward is what you are after. Suffer now and live the rest of your life as a great medic. Medical school. What I think I will look like after med school. How I actually look like. No, this is not how I look like. I am in my final year, and at least I am not as this one. So anyway, I'm not looking this way. It is not like me. It is not even with my colleagues. Even those that are watching, you are not the one. So guys, this is the end of my first reaction video, and this is reaction to medical memes part 1. Hope you enjoyed the video, and don't forget to subscribe, like, and share. I will see you in my subsequent video.